Hi, everybody who's just come in. You're all very welcome. We've a fair few people signed up for, or that registered for the taster today. So if you're okay with it, I'm going to give it another 2 minutes to let people get in before we do some introductions. And you can feel free to turn your cameras on if you like. Nice to see you all. My name is Joanne. I'm the student recruitment manager here at Tangent. Hey, Megan. Blackwell, is that your name? I'm not sure it says Blackwell.
Yeah, my name is Dixon.
Dixon. Okay.
Hi.
And Kerry. Hey, Kerry.
So folks, we just ask you to mute for while we're setting up, if you can.
Yeah, so as I say, I'm just admitting more people. That's why I'm going to hold. We're going to give it another minute just to be a good few people joining in here now. Just give it another minute. Okay, so I think we'll start off. Other people may come in as we go along. Again, my name is Joanne Corley and I'm the student recruitment manager here at Tangent, and really appreciate you all coming along. Delighted that you're all here. If everybody could put their microphones on mute, that'd be great, so that we don't have any kind of feedback or that just while we're talking there and can't hear any background stuff going on. That'd be great. And hold on, more people coming in. And as I say, just to let you know, I'm going to be here at the end of the class, so that for the last 5 minutes, so that if you have any recruitment related questions or want any information or that, I'm going to come back in and I can talk to you then. And Jan Decor, who's here with us as well, she's the program coordinator. She'll be here as well at the end of this session. So if you enjoyed this session and feel like you'd like to apply for our postgraduate certificate in healthcare innovation, which is a fantastic course, please do just stay to ask questions for the last 5 minutes. Okay, so I'm going to hand you over to Jess Hayden from Brave Lab. And Jess is the our main contributor, our main lecturer for module 2 on the course. So I'm going to hand over to Jess and she's going to give you a taste of what our courses have to offer, of what this course has to offer. So I hope you all really enjoy the session and I'll see you again at the end of the session. So enjoy. I'll hand over to you, Jess.
Thank you, Joanne, and good afternoon, everyone. Lovely to see you all. So as Joanne said, I'm a contributor on the Healthcare Innovation Programme, and I think I've actually been involved since the start. So this will be the 5th time we've run the Healthcare Innovation Programme, and so we've had 4 different cohorts who have all kind of been through it by this stage. And what I've done to kind of give you a taster of it is to pick out some highlights of examples of empathy and innovation that we've covered in the different cohorts over the years, and try and get a sense as well from you what you're interested in, and how perhaps even if you decide to do the program, you can get an idea of what tools we might use and how they might be useful in your different settings. So I will share some slides. And I'm going to do that now, and then I will tell you a little bit more about myself. So it's nice to see some of your faces. So I'll ask you in a moment now if you can see my slides. I can see. Yes, I can see Jan nodding. Okay, great. So what I want to talk about today is empathy and the role that it can play in healthcare innovation. And really, I suppose the role it can play in any kind of innovation, but we're going to focus on healthcare today because but we're talking about that healthcare innovation program. So what I wanted to kind of cover is a little bit about like what actually is innovation, what kind of definitions might we use, and what are helpful to us when we're innovating in healthcare. And then what is empathy? Like what do we mean when we talk about that, and how might we get a sense of it? And then why is it a useful thing in innovation? So we really only have about 50 minutes to go through this. So it's not a deep dive, but we're kind of more tiptoeing around some of the content that we'll cover. But I think if you know, having spoken to past pupils of the program and having worked with so many cohorts, I think this is the thing that stays with most people. And it's not that they didn't have empathy before, it's that they now have tools to go about it in a really structured way, and ways to bring empathy or insights that they've got about people they're designing for into their work. And there's a lot of people who leave the program really convinced about like how empathy can influence design in a positive way and make better solutions for everyone. So that's why I chose this topic today for us to talk about. So as I said, I'll tell you a few bits about me. I'm an organizational psychologist by training, so I specialize in how people work and how people behave at work and do their best work. And turns out that's quite a handy thing to have a background in when you're looking at innovation, because a huge amount of what we do in innovation is having cognitive flexibility and shifting mental models, being able to cope with change, being resilient to change, leading others and things like that. But so I run my own business called the Brave Lab, and we specialize in helping people design fairer futures. So we're very forward facing at the Brave Lab, and we really look at kind of systems change, and we look at innovation in the public sector and the private sector, all over the place. And so I like kind of learning and exploring new things, and the picture there is me having my brain mapped about, I think, 8 years ago now. But I suppose I've always been really curious about how people work, how the brain works, and I bring a lot of that into my teaching. So that's it. That's a little bit about me. I'm sorry, my slides clicked the wrong way there. So I have a question for you, and for this, I'd like you to pop your response into the chat window, if that's okay. And please tell the truth, okay? There's no one going to be looking at this information. It's really just a kind of a sense check of, 30 people in a room. Do you regularly use sun protection factor? Do you regularly use SPF? So I'm going to have a little look at the mostly no's. A few yeses. So regularly, I suppose not enough. No, it's in my moisturizer. Yeah, okay, fair enough. So I went to Mole Scan. I don't know if you've heard of Mole Scan, and they gave me this leaflet about skin cancer a couple of weeks ago. And I also got like a lecture about how often I should wear sun protection factor. And even though I'm like quite good at it, it is in my moisturizer, and I do apply it on a sunny day, apply factor 50. I don't wear it regularly, and I certainly don't wear it as much as I was told I should be wearing it. And I would have thought myself to be quite, quite invested in protecting my skin from the sun. So if you're one of those people that thinks like, no, I don't wear it regularly, or maybe not enough, what is the main problem? Why aren't you doing that, do you think? And be as honest as you're comfortable being in the chat window. If you're not wearing SPF regularly, why not? Somebody saying yes, it's been on holidays. It smells weird and sticky. Thanks, Megan. Okay, any other reasons? I see hands and clothes, yeah. I will wear it if it's in moisturizer. Okay, so Sharon, you're giving us a design insight right a way, which is if you can make it fit into my life as it is, a thing I already do, I will wear it. Okay, a lot of people complaining about the stickiness. That's interesting. Okay, I like a healthy glow from the sun. Whether or not it's good because there's too many chemicals in it. Okay, don't realize it is sunny. Okay, more products to buy, more money to spend. It's not in your bag. Okay, again, the convenience factor. There's a really nice design insight there. It's in cosmetics, very greasy, not outdoors too much. Okay, so lots of different, yeah, and vitamin D. Actually wasn't, I thought you could still synthesize D with SPF on, but I don't know, to be honest. There's loads of different reasons, right? And the reality is it'll be probably something a bit different for each one of us. But there are some themes that have cropped up there. Convenience is a big one. Like it's not in my bag, or it has to be part of my routine that I've already established. Habits that we've already formed, we're probably unwilling to disrupt unless there's a very good reason. It turns out there is a really good reason to use SPF. And we in Ireland, we know that we've got one of the highest rates of skin cancer in the world. So what's going on? This is where we can see that if we kind of look at the journey of people who could benefit from wearing more SPF, we can find pain points along the way if we empathize with them and try and design ways to alleviate those. So this is a product that I was told about by the clinician who did my mole scan recently. It's a powder form of SPF, which I'd never heard of before. And I don't know if this is the exact one that she was recommending, but she had talked about your parting in your hair. That if you're not wearing a hat, you should really have SPF on your parting in your hair as well, which is something that I had never done. She mentioned this powder format because you can't just get the greasy stuff and put it in your hair, and people can become quite conscious of how that looks. So this is one, it's got a little brush on top so you can kind of dab and it's tinted. So I think it doesn't look white against your hair. And that's what she recommended. So I'd never heard of this product before. And I thought, is that innovation? I'm not quite sure. So if we look a little bit at a couple of different definitions, there are many people who have tried to define innovation over the years, but these are two definitions that I like to compare because it gives us two very different perspectives on what it is. The first by Everett Rogers, he's a theorist who come across quite a bit in the world of innovation. An innovation is an idea, practice, or object perceived as new by an individual or other unit of adoption. So he's saying as long as the person using it thinks it's new, then it's innovation. He doesn't talk about whether it needs to be commercialized, whether it needs to make money, whether it needs to disrupt another market incumbent. He doesn't talk about any of that. All you have to do is that the person who uses the thing needs to perceive it as new, and therefore it is then innovative. Or we can take a much narrower view of what innovation is, and this comes from Kenneth Morse in MIT. Innovation is invention plus commercialization. So within this definition, we've got that need to get it out into the world through a business model in a way that is profit-making, commercializable. So that's quite a restrictive form of innovation. And I would choose, one of the things that we do on the program is to get you to think about which one is most appropriate for you in your setting that you're in. You might be in a setting where it's not going to be considered innovation by the organization unless it makes a difference to the bottom line. It mightn't be considered innovation unless it's actually going to turn a profit for the organization. Or if we bring something to a group and it's perceived as new by them, maybe that's the definition that we'll use. So if I go back to this new type form of SPF, the powder format, is that innovation, do you think? You can pop your responses in the chat window. It is to me, so Noreen, yeah, Suzinda, okay. And why? Why do you think it's Noreen or Enda, feel free to pop on the mic and come on.
I've never heard of it before, and it's a great idea because I'm a redhead.
Okay.
I burn very easily, so it's very interesting to have options.
Yeah, I'd never heard of it before either as well. And I'm very fair skinned, so I burn easily. So so therefore that kind of first definition of innovation, it's perceived as new by the unit of adoption. That's that would be the definition that we're applying there. The thing I haven't told you is the price point. Any guesses? I was shocked, I have to say. 40, I'm sorry, Sharon, it's double that. It is $79.99. Now, maybe there's a cheaper one out there. This is what I found online. I will not be shelling out €80 for this, I have to say. I will be wearing my hat more often instead. But this is another part of innovation that we have to think about, which is, okay, we perceived it as new, but how are we going to get our hands on it? And is something like this, is the price point of it too high that it's actually going to create inequality between us and other people in the market who may be willing to spend that money? So I think this is a really interesting one when it comes to skincare, and especially with regards to stuff that prevents skin cancer. Okay, all these products that we're being told we need to use and use regularly and use in large amounts are costly. So every time we create a product like this and we innovate and we make it so that only a certain part of an overall addressable market can get that innovation, we're actually driving inequality. So there's layers and layers to what innovation could or should be. And I would argue in healthcare, when we're innovating, we need to make it accessible to all. We need to make it universal design. And we need to make sure that people whose voices don't often get heard in the healthcare setting are very carefully listened to, so that we can design something that's better for everybody. So we've talked a little bit about what innovation is. Well, how can empathy help us with that? So in this, this is the diffusion of innovation. It's quite a famous curve developed by Rogers, and as I said, he's a theorist you kind of see a lot of in the innovation world. And he talks about how innovations tend to flow in this way through a market. So if you think about maybe the people who might be using that powder form of SPF, right? At its really high price point, €80. Now, maybe they're not all €80. Quick Google might tell you a bit more, but this particular one is. So that we've got probably only a small part of the market that will pay the higher price point to have their pain relieved in that market. And he called those people the innovators or the early adopters. They're that first kind of chunk in a market. We only then see the big chunk of the early majority come on board when the price point tends to drop and some of the kinks or the kind of technical specifications of a product get worked out. And then as we see more people in the market adopt a technology or an innovation, it's usually when the technology or innovation itself stabilizes, it becomes really predictable, the price point drops really, really low, and actually it becomes harder to be in a world where you don't have access to this. Mobile phones are a really good example of this. Some of us probably remember a time where it was really unusual to have a mobile phone. I think the first mobile phone I got was in 2002. And I was very much a laggard. So one of the last people in the market, in the addressable market, to get it. All of my friends and acquaintances had mobile phones, and I missed out on a lot of stuff because I didn't have one, which is why I got one in the end. But everybody will be a different type of segment in the market, depending on when they will adopt an innovation or want access to a new technology. There's a link there to a really nice blog on some of the reasons why things don't get adopted. And we can say that SPF is not well adopted, right? We just did a very non-scientific poll of this room full of people, and we saw patchy use. We saw some people say, yes, I do apply it regularly, but others kind of saying not enough, or I'm not doing it as often as I should be. So why might that be? So we can start to think about a couple of different behavioral things that we see in people that might help us understand why we don't have that kind of adoption. So we might see that people know about the products and the benefits for skincare, but they don't have a favorable attitude. Maybe like as we just did in our quick poll, we find that people just don't like the stickiness of it, or there's a convenience factor as well. Or maybe we find that people know about it and they have a favorable attitude towards it, but the practice just isn't there. The habit hasn't been built in bringing it into our daily lives. And again, we saw a lot of people say, well, if it's not in my bag or if it's not my daily routine, it's not going to be there. So we can start to think about if let's say we want an innovation in a healthcare setting to take off and to make sure that it's fully adopted, or all the people in the addressable kind of group that we want to have using the innovation and start to use it. We can start to think about, well, what barriers are they facing around knowledge? Do they know about it? Do they have enough information to make an informed decision about accessing this? What about their attitudes? Are their attitudes favorable towards the thing itself and how it's delivered to them, to the price point of what it costs them to access it? And then what about practice in terms of how they can bring this into their lives? How can we deliver this innovation in a way that is seamless, that kind of meets people where they're at? So we can start to see that maybe if we really understood what it was like to be in the position of the people that we're designing for, we'd be able to design a much better solution. And this is where the role of empathy kicks in. So this is Terminal 5 in Heathrow Airport. Has anyone ever been here? Yes, a few nodding heads. If you've ever had an international transfer through Heathrow, you've probably been in Terminal 5. So it opened in 1998 to much fanfare. And at the time, the project was 30 years in from project inception to when it opened its doors. It was a really, really large project. They had to divert 2 rivers from the site in order to build. They did an archaeological dig on the site and they found 80,000 artifacts of significance. There's somebody that isn't on mute and there's a bit of background noise there. So I'm just going to ask you to mute yourself if you can. It is just a bit distracting for me, sorry. So yeah, so in the airport, they wanted to make sure that this airport was the best airport terminal in the world. Okay, so when the project was finally got off the ground, they decided that that was their ambition. It was to be the best airport terminal in the world. So if you were tasked with that, if you were told, right, I want you to go off now and build design the best airport terminal in the world, where would you start? What would you do? You can pop on the mic or you can put your answers in the chat. Comfy seats, says Megan. Could all do with comfy seat in an airport, couldn't we? What else would you do? Ask what the customers want, ease of access, build a metro link. And it will be, yes, hopefully one day, visiting other terminals that are good, essentially, yeah, identify requirements and users. Yeah, so that's exactly what they did. They got a design team and they decided to hire a bunch of anthropologists to go and look at how other airport terminals are used. And the anthropologists looked at everything. They looked at how people move through the airport, how they check in, what they do with their baggage, how they move through security, how they eat, how they use the bathroom, how they get to their gates, how they process information. And they made a really interesting finding. They found that there was a particular age group, the over 75s, were using the bathroom twice as many times as they thought they would. So they were using the bathroom on average 4 times an hour. So when they looked at this insight, and they looked at the number of travelers that would be over 75 and then the number of toilets in the new airport design, they thought, okay, there's a big problem here. We're just never going to have enough toilets. So the design team said to the anthropologists, well, do we know what they're doing in there? And the anthropologist said, well, no, we didn't follow them in there. I said, well, could you ask them why they're going in there 4 times an hour? So that's what they did. And they made a really interesting finding. They found that this group that were using the bathroom 4 times an hour on average, they were going in there, but they weren't using the toilet. What do you think they were doing in there?
Washing their hands.
Washing their hands is good. It's not right. Sitting, medication. Any other thoughts? Oh, lovely. Singapore's a waterfall. Very nice. What's it like in the bathroom that it's not like in the rest of the airport? Checking documents, sitting down, bit of space, quiet. It is quiet, yes. Why would you want it to be quiet? Call. No. Well, nowadays, that's probably why you do it. But back then, phones weren't, this is 1998. To hear the announcements, that's why they were going in. So when they sort of dug into this insight and they went and spoke to more people about their bathroom use, which you can imagine is probably not an easy conversation, they found that this is on average, this is why people were going in more often. They would hear a bing bong and they would realize, okay, that's a flight announcement. This age group in particular, the over 75s, tended to be a more anxious traveler than other age groups. And they wanted to know exactly what this flight announcement was going to be like. So they would rush in to the nearest bathroom to try and hear it more easily. So what did they need then that they didn't have in that scenario? Access to information, yeah. More speakers, yeah. Hearing the announcement without distractions, announcements louder, voice clarity, yeah. So loads of different problems that we, I think, experience. That sounds like first-hand experience there. Announcements in airports are really hard to hear, aren't they? So in most airports now, I think they've actually stopped using them, or they're very infrequent now, because based on this insight, they did a good bit more research and they realized actually loads of people have problems with the announcements in airports. So they trialed making them louder, but that actually made it worse. They tried lots of different things, and in the end, they realized very few announcements are better. And actually for really, the best thing to do is get people to check the flight information and just notify there is a change and get them to check the flight information. So what they did in Terminal 5, instead of making announcements louder and so on, they had far more places where you could see the information. They also, at the request of lots of different people, they had, I'm not sure they still do this, but they did at the time have actual people with high-vis vests on who you could go and ask for information if a flight change had happened. So that's empathy, right? Is not just looking at a situation and deciding what you think the problem is for someone, that they need more toilets. It's really understanding what it is like to be that person in their shoes, traveling through an airport, and what is it that they need that they don't have, asking that question over and over again. So this is, I love this example because it kind of, when we start doing this on the program, we start thinking about like, what's a problem we want to solve, but it's always stated from our perspective. Now we may have firsthand experience of it, so it may be informed perspective, but we're almost always making lots of assumptions when we start off. And the whole point of the program is to address those assumptions, validate them with evidence, and go through the entire journey of a service that we're trying to innovate or a product that we're trying to innovate, so that we can test all our assumptions and then have a really good solution at the end that actually works for people, rather than making an assumption about what people need and building too many toilets. So I'm going to move on from here and talk a little bit about one of the tools that we use to start kind of crystallizing insights when we do this type of research. Now, in the Healthcare Innovation Programme, we don't have a team of anthropologists that we can send out into healthcare settings to discover insights. We do it all ourselves, right? And we do it with our network in the class. So the classes tend to be quite big. And so there's people from all different kinds of backgrounds, and somebody somewhere will know of a research report that will have all the statistics you need about a particular thing you're interested in, or somebody else might know of a really good patient advocacy group that has gathered lots of testimony from patients so that you can really understand what it's like for somebody to have a particular disease. But once we kind of do lots of research and we gather insights from lots of different places, we try and then format it in a way that's really, really useful. And this is a little kind of an insight map. It's a persona map, and it's based on a fictitious couple called Gladys and Pat. So we give them kind of fictionalized demographics, and they're in their 80s and they fly from Dublin to London to see their son. An interesting fact about them is they get to the airport 3.5 hours before their flight time every time. So there's a couple of key insights that we've got from speaking with people like Gladys and Pat. The first one there is they want access to information from a real person. And what they say is the most important thing is there's a real person to ask if we don't know where to go or can't hear the announcements. Another key insight then is that their needs are often unmet with regards to resting spaces. Our ideal airport has places to sit all the way to the gate. I hate having to lean on Gladys to get to the gate. And then another insight, better accommodation of needs increases their travel. So since they added more seats and someone to ask questions, we travel nearly every month to see our son and grandchildren. So this is fictional, but it's the kind of stuff, the kind of tool that we'll use, and it's what people and what we'll find is like if you pick a kind of a healthcare challenge that you'd like to address, and you'll go off and you'll look at information from all different kinds of sources, and then use this type of format and tools like this to try and validate. Here are key insights that will inform our design questions. But we can see that having real empathy with people like Gladys and Pat will help us design better services, better products, and not just for them, but stuff that works actually for everybody. And this is that concept of universal design, that if we listen to the needs of people who often don't have their needs met, we'll often actually end up with something that is far better for everybody in the situation. And we'll also be able to kind of drive equality instead of wedging more inequality between people who can access something well and people that have barriers when they're trying to access something. So this is a really, I think, powerful image, and it's one of the techniques that we use on the program, and it's a way to gain physical empathy. So it's called body storming. And what we're trying to do here is just gain that sense of empathy. What is it like to be that person in those shoes at that time? So solving a problem for someone requires that understanding of the problem from their perspective, as if you had the problem yourself. And a good way to develop it is to body storm. So it's just designing experiments that allow you to feel how the person you're designing for feels. So in this situation, this woman is designing a control panel that's to be used in a space station. And while you can see the different kind of formats she has here on the whiteboard. She's trying to design all the different dials and controls that people would use. And she realized actually when people are using this, they're not going to be using their bare hand. They're going to be in a spacesuit with a helmet. That's kind of restricted. That will restrict their view. They won't have fine motor touch, and they grasping and holding things will be restricted by wearing a glove. And they'll have kind of heavy temperature control suits on, which are bulky as well and restrict your movement. So in order to get a sense of what that would be like, she's gotten some stuff that is certainly not space age, but it's motorbike equipment, so helmet, jacket and gloves, to give her a sense of what it would be like how much manual dexterity am I really missing when I have a glove like this on? How much is my field of vision restricted by a helmet and the movement of my head? Like what's a realistic position for me to be in so that I can see stuff when I'm trying to operate this control panel. That's body storming. And it's a really powerful thing to be able to do in healthcare innovation. And because we're often designing for people that have really multiple barriers, multiple restrictions in how they experience something. And sometimes we can design experiments that help us get the feel of what it's like. And I know that this practice, I think, is quite often used in healthcare settings. And I know of some training programs where medical people are asked to feed each other in a class, so as to understand what it's like for a patient to have to be dependent on somebody else to feed them, or other healthcare workers are asked to try and navigate a space using a wheelchair, to understand what it's like to be using a wheelchair in a space. And it's really only when we've tried it ourselves that we understand what that's like. So if there's any examples of this from your different different fields, I don't know where you're all from, but if you have examples of this, of really understanding what it's like to be in shoes, pop them in the chat window. I always love hearing of other examples. We see it a lot as well in customer care. Loads of organizations will require that in your induction period in an organization, you have to spend some time on the customer care desk and listen directly to people who are experiencing your product or your service to understand what their pains are, what their gains are. They're most often talking about their pains though when they're on the phone to customer care. But this is something, again, that we would be trying to encourage people to do. It's not always appropriate, right? You can't always design an experiment that allows you to feel how a person you're designing for feels, but you often can. Even just by observing a space, walking through a space, and understanding what it'd be like, even from a kid's perspective. Something I realized a while ago, bringing my daughter for an X-ray, is that everything, you know, in hospital setting, even in the kids' hospital setting, so many things are at adult height, and everything just must appear like really huge to kids. I have some lovely examples of coming up of how this kind of empathy can make a massive, massive difference in design. I just want to check in on the chat window. So we have a few examples here. So thank you for these. Hold on a sec. Megan is saying, in early education, looking through a mirror to write our names on the alphabet. Oh, wow. So I'd love to hear more about that. And what I think that would really confuse me. But maybe if you can tell me a little bit more about that, Megan, I'd love to hear it.
I'm trying to remember how they had the mirror set up, but basically using one or two mirrors on an angle while having our paper, and so that you could only see the paper.
Yeah.
I don't think it was a perfect application of dyslexia, but
yeah. Okay, I think I get it now. But you're kind of writing, but you're looking at your handwriting in a mirror. So
right.
Yeah. Okay. Wow. I must try that. Okay. Thanks, Megan. That's a great one. You should try the thickeners for people with swallowing difficulties. Oh my God, it tastes terrible. Oh, poor Noreen. Oh.
Yeah. Or you should taste it. It's like some kind of, it turns the food into glue.
Oh God. Yeah. That is tough going. That is, yeah, that's exactly the kind of stuff. Have you tried them yourself?
I tried it because the patients were complaining about it. So if they're complaining, you should try it. It's terrible.
Fair play to you, Noreen.
Yeah.
That's body storming 101 right there. You're a pro body stormer. That's brilliant. It is though, and you really don't get it until you try it for yourself. That's great. Okay, and then let's say Nicole, during my nurse training, the 90s. Yeah, we did this. I've heard that it was more popular a while ago than it is now, but maybe it's still there. And using thickeners for swallowing problems. Okay, great. These great examples, folks. So yeah, like one of the things that we would do, and as I said, not every problem that you want to address in a healthcare setting, you'll be able to body storm. But sometimes you can, and it's really, really powerful. So I'm going to talk a little bit about some of the examples of fabulous design that we get when we do empathy really well for people. So this is PillPack. It's an organization that is now a part of Amazon. I think they bought them back in 2018, but before that they were a startup, and they decided that they were going to revolutionize the whole pharmaceutical industry by understanding what are all the pain points that people who take medication on a daily basis experience. So they came up with these blister packs. This is their, I suppose, their real innovation. There's lots of different things they've done in an innovative way, but this is one of the ones. So you can see that little roll there. Each one of those is like a label that has the pills in it. So it's like a little pocket. And on that, it tells you what pill is in there, and it has the instructions for how you need to take it. And then it's delivered in this kind of, I don't know what you call that. It's like a label dispenser. so that you can just pull out what you need at the time, and then the next one is ready for your next time. The time and date is on it as well. So they use design to go through every single pain point that a person experiences when they're taking medication, and they designed a solution for everything, and it's really, really impressive. And this is kind of by really putting themselves in the shoes of a person that has to take multiple medications on a daily basis. They came up with this design. Another great example that I love, and I swear I don't make commission, but if you've ever, has anyone ever used an OXO Good Grips kitchen utensil? No, they're amazing. They're really good. And I don't have arthritis, but they were in fact designed for people who have arthritis and have manual dexterity issues. And they have this thing on their website that they are obsessed with pains in the neck and things that really annoy you. So the insight for OXO Good Grips kitchen utensils came from I think one of the people, I'm not sure if it was Sam Farber, might have been him, but one of the people observed their partner trying to peel potatoes with arthritic hands, and realized it was very, very difficult for them, but that by simply kind of widening the handle and putting these kind of texturized rubbery grips on the handle, it makes it not just easier, but kind of more it's actually a nice experience now to peel potatoes. So I have a potato peeler. I had a grater, but it fell apart because I used it so much. But there's something, if whether you buy one or not, next time you're in a kitchen shop, have a feel of one of these things, because you'll see the difference that design has made. Especially if you've got any kind of dexterity issues, they're great. Oh, sorry, I have another great example here. Having a foot dressing on for several days and keeping it dry during showering, walking. Oh, in diabetic ulcer patient shoes. Wow, Kerry, that's just even reading that description like that. And it is, I can't imagine how hard that is. But yeah, like if we're going to be working with people that are experiencing this, it is really interesting to be able to know what that's like. Thank you for sharing that, Kerry. But this is, I think, one of the other things that I'd like to point out about the OXO Good Grips is that when you're innovating and you're designing for people that have, a pain in the neck, sometimes it's also a pain in the neck for loads of people. I am not arthritic, but yet I find peeling potatoes, especially in cold water, really unpleasant. But the other thing we find is that while you're there, while you're changing something, it's a chance for you to deal with your gripes. So that's another thing that we kind of do in the healthcare innovation class, is we ask people to kind of list what are all the pains in the neck about healthcare. How are you experiencing them? Where do these things show up? Who else is impacted by these? Should we then try and change it? So these kinds of gripes can lead to really interesting innovations. There's also cases where real empathy with the problem that we're trying to solve can literally save lives. So what we've got here is an example of a micro innovation. It's a small change to how things are done. But in this actual example, we've got evidence that it has actually reduced morbidity. So what it is a surgical safety checklist. And it's a simple set of procedures that are done before the patient is anesthetized, and then just after that, and then when everything is finished and they're signing out. And this came from real empathy with the teams and the patient as well. So everybody involved in the care of a person plus the patient themselves in a surgical setting. And one of the things on this form that they do is have all team members introduce themselves by name and role. That's a really, really simple thing. But it's a checkbox to say, okay, we've done that. So we know who's in the room. Everybody's masked up. Maybe it's not easy to know who's there. And so we introduce ourselves by name and role, and that, along with a couple of other things that we do, actually reduces morbidity rates. And in this study, they looked at where this checklist was introduced, and it was quite significant. And deaths went from 1.5% to 0.8%. So here we are, something small, something really doable and manageable, based on real empathy for the people involved in the situation, is literally saving lives. I see Nicole Houston's. Yeah, we had a surgeon on the program 2 or 3 cohorts ago, and I asked him, do you use this? And he said, yeah, it's great. And he had experience of before it was introduced and after, and he said it is a game changer. It's a really, really good tool. So yeah, I love things like this. Like, this is simple enough. It's based on empathy. It's well designed and literally saves lives. I have a few other nice examples as well before we kind of wrap up. And this is one a bit closer to home. This is a vaccination centre in Cavan who decided to do some superhero vaccinations for kids. And one of the quotes by I think the centre manager is, some of the children don't want to go home after the 15-minute observation, and that's a good sign. So this is a really, really simple design, and obviously there's part of the innovation here isn't just the idea, let's wear superhero costumes. It's in the delivery of it, it's in the execution of it. It's like everybody has to agree that this is the right thing to do and like get into it. And that's a big part of the innovator's challenge. You can have the best idea in the world, but if you can't convince a team around you to change their behavior, it's going to fall flat. So we talk a lot about that, because I think most of the people on the program do have some experience in healthcare settings, and they can speak to how difficult it can be to create change unless you've got people on board. So getting them on board is a big part of what we talk about. Yeah, that's it. It was great. Even a small thing, like my daughter is 5, and she has, when she was getting her COVID vaccines, they just had like really nice coloring pencils and loads of little pictures printed off for the kids to draw. And suddenly for her, then it was actually an enjoyable thing. It went from, I have to wait around in chairs and then be scared for a little bit, to, oh great, I get to color and I've forgotten why I'm here, so it makes a massive difference. But small little things like this, can that be considered an innovation? I say absolutely, and especially because it's improving lives. And you can argue that this one is saving lives too, right? If more kids are likely to stay for their 15 minutes and go back for their boosters and their follow-ups, then we know if we do this enough times, we do it consistently, that it will save lives. Okay, so folks, that's all I kind of wanted to cover with you today. So I wanted to just see if there are any questions or comments or anything from the group, any questions that you have about the program or anything that we've covered so far. No questions. So folks, if you it would be interesting to know what kind of areas you're from. Are you from healthcare settings or not? Okay, so we've got a few strip nurse, healthcare, podiatrists. Okay, oh, loads of different backgrounds. Great. Okay, cool. So hopefully it was all for you. There's a question from Sharon there. Jan, I'm wondering, this one might be better dealt with by you, but I did the RCPI course on QI. Is it at a similar level? I don't know that course, Sharon.
I don't know it either, Sharon, apologies. If you have the level that was accredited by QQI, then we can look at it if you want. If you have it, Sharon, that's no problem at all. We can do that for you.
Okay, great.
Level 9, yeah, no, so you'll find everything that is level 9 is the equivalent of what we do here in Tangent is also a level 9. So you already have a level 9, and you'll be fine to apply with us in Springboard directly as well. That's no problem at all.
Jack saying no background in healthcare, but marketing needs to be worse. No, and then we've had people that want to get into either healthcare or innovation, specifically in healthcare, from completely other backgrounds, do the course before. And so no, they did fine. I think you're going to be in a room with people that have lots of experience though in healthcare. So there's great learning, I think, in that, especially if it's a place you want to break into. But then equally, one of the things we do quite a bit in innovation is we take different lenses. So what would a marketer do in this situation? Or, what can we learn from the world of education that we can apply to healthcare and so on? So definitely having a different background won't hold you back. There'll be lots to learn, I think, from the other people in the group, but equally you'll have lots to offer as well. I don't know if Jeanne or Joanne, if you have anything you want to add to that one. You've seen all the cohorts, Joanne.
Yeah, yeah, there's a variety of people from all different backgrounds, many from medical backgrounds, but as you say, you know, if you've an interest in that area and you've some sort of a background in it, then definitely, you know, it's the place for you. You don't necessarily have to be a doctor to do the course, so to speak. There's plenty of other areas of interest completing the course as well.
Yeah, and in fact, actually, we find that the teams, you do a bit of group work, and the teams that have really different perspectives on them do really well.
Yeah, that's so true, because yeah, Jess normally organizes groups so that we have people from different backgrounds in each group. So you may have somebody who's got, you know, physiotherapy background and a nursing background and a you know, surgeon background or whatever, you know, all these different backgrounds, and everybody learns from each other. Somebody who's in management, who's like in management in some sort of healthcare area, admin kind of stuff, and everybody helps each other and learns from each other, which is really fantastic.
So there's a really interesting group on this call, actually, and it's kind of, I think it's actually probably representative of the normal kind of group that we get on the HINO programs, a real mix, which is brilliant. So I'm still going through the comments now, folks. Community nurse, brilliant, okay. Particular interest in kids who've experienced loss, would the course be appropriate? So I think it depends on you know, if you're, what you're trying to explore. I mean, obviously that, I'll tell you a little bit about the module 2 that I work on, where we first of all, we look at trends in healthcare. So we look at what's going on, we look at the program for government and see like what's being funded, where is change happening. And then teams form around those different trends to find a thing that they'd like to see. Can we solve a problem in this area? Is there a challenge that we think should be addressed? So whilst we don't cover like topics as specifically as kids who've experienced loss, it's obviously something that could inform, you know, design and solutions that you might generate. I don't know, Joanne, if you can talk a little bit about module 3. I think is that where people get to look at their own initiative, their own project?
Yeah, that's the venture planning module. So module 3 is done in collaboration with the School of Medicine. So Dr. Alison Keogh will be delivering that module, and in that it's about your venture and about it's exploring that whole area of your own businesses, or whatever way you want to set up your own ventures. So that's kind of exploring that part of it. And Dr. Carl Thomas does module 1, which is all about innovation and creativity. He's fantastic. He's in the business, Creativation is the name of his business. You can look him up as well. But sorry, Jess.
Yeah, I was just going to add to that one comment there about kids who've experienced loss. There's loads of opportunities for you to bring your interest area in, but we wouldn't cover any specific healthcare topics like that. We're more interested in where are their problems and how can we design solutions for them. So hopefully that answers your question.
So Jess, whenever you have a minute, I'll just.
Yeah, sure. I think we've dealt with all the questions that popped up there. So I'll hand over to you now, Jan.
Yeah, so just wanted to see how many of you, if you wouldn't mind, could you type a yes into the, if you're aware, basically I know that a lot of you just signed on here from a taster session from seeing it on LinkedIn or that. Are a lot of you aware that this is a Springboard funded program, so it's free if you're unemployed, and it's 10% of the $3,000 fee if you're employed? Or if you could throw a yes in, are you all aware that this is a Springboard funded program? Yeah, okay, so a good few of you are, it seems. Okay, so basically, if you are interested in the program and aren't aware it's a Springboard funded program, if you go into our website and click on the apply now, it will bring you to Springboard. And Springboard requires a number of documents because the government are giving the money to everybody. So that it's not up to us. It's like this, the government are asking for these documents. So after creating a really easy list that I can email out to you, because it can be hard to follow when you go on the website what documents you need. And what we find is the application closing date for this course is the 22nd of November. And what we find is a lot of people go to apply on the 10th of November thinking they've plenty of time. And then they realize, oh gosh, it's going to take me 2 weeks to get my transcripts because I have to order them from my college because I can't find my parchment, you know, or I can't find my academic reference. I'm finding it difficult to get this out of the other. And people end up missing the application, or because we're offering on a rolling basis, they end up disappointed. So as I say, there's 42 places. So if you're interested, if you just type your name into the chat there, I'll email out that document, which has a list of the application documents done very clearly, and a list of the eligibility documents, which once you apply and we say, yes, we accept you on the course, then the government wants you to upload your eligibility documents. And as I say, so that's all in one nice list that I have. So if you want that, just throw your name in and I'll email that out to you. And then after this session. And then another thing that I wanted to let you know is that we have an open evening on next week. So next Tuesday. So you'll be invited to that by our, after this, you'll get an email on that as well. So you'll get an email inviting you to the open evening. And at the open evening, you'll get to come into Tangent and have a look at the space you'll be in on Saturdays. It's a great space. It's a beautiful building. So you can come on in here and meet us all. And there'll be like a panel discussion and stuff like that. So that's on Monday evening. And the one that's on for healthcare innovation is on from 6 until 6:30, isn't it? 6 to 6:30, 5 to 6. Yeah, 6 to 6:30. So if you want to come in there to that. But as I say, what I would encourage you to do is to get your applications uploaded to Springboard, start your applications as early as possible, because what happens is we check your documents as they come in, and if there's any issues with your documents, we get back to you really early so that you're not left stuck at the last minute. Okay, so I just wanted to kind of let you all know that. And thank you very much for coming along. Does anybody have any questions? You can put your hand
there. I'm happy to take from Sharon how much coursework homework is it.
Oh yeah, there you go. Jess, thanks.
So yeah, there's the attendance at classes, which I think, John, you've just gone through there. There's the actually, can you remind me what format this one is? Is it Saturdays and Fridays?
It's Friday online and Saturday face-to-face, and
so
it's
yeah,
every second week.
Every second week. Okay, yeah. So yeah, Friday afternoon and then all day Saturday every second week. And the attendance is really, really key, because of the way we teach the program. It's done through experiential learning. So there's you need to be in class to get your head around the tools and how we're going to use them. There's also a lot of group work, and you're going to be dependent on the group you're in, different people doing different things, and you have to stay aligned. So if you miss sessions, it's really, really hard for you to catch back up to where the rest of the group will have gotten to in that time. So do check the dates and make sure that you can make them. You need to have 80% attendance to pass. So that's one part of it. And then in terms of kind of homework, there is some work outside of the class time as well that you will need to be able to do with your group, and it very much depends on the group and what works for them. We spend a bit of time making sure that groups talk about what's realistic for them in with that, because sometimes we'll have people who are on night shifts, sometimes we'll have people who are doing different working patterns.